It is my pleasure to invite Mr. D, Eric Dalgety, and Margaret Peel from Geraldton Regional Aboriginal Medical Services. We at the University of Western Australia have a wonderful relationship with them. They would tell us about the collaboration between GRAMS and UWA, the School of Optometry, and WACRH, WA Centre for Oral Health, who have been instrumental in helping this partnership in establishing a permanent optometry service within an Aboriginal community-controlled health organisation. Over to you, Eric and Maggie.
I'll stand. Hang on. Can you hear me? Yep. I'll stand this side because Maggie will disappear under this. It's great to be here today for the conference. My name's Eric Dalgety. My co-host is Maggie Peel. We come from the Geraldton Regional Aboriginal Medical Service up in Geraldton, GRAMS, which I've been a part of for the last 20 odd years. A little bit about myself. I'm born and bred in Geraldton. I'm a Wadjuri man on my dad's side, and I am a Nudju man on my mother's side, which is the Goldfields area. In saying that, I'd like to pay homage to the Wadjuk people for whose land we meet on today. And we're going to be speaking briefly off the cup, so I don't come with any stats or anything to run by us, but I'm just going to be speaking off the cuff about our program that we run up there in Geraldton since the development of our new optometry service. So if we can, where are we? So if we can just go back probably, let's say about 8 to 9 years ago when I was asked to take over the eye health department. Currently, before that, I was the health practitioner, just doing a health practitioner, and there was a need for someone to run the eye health sector. So they asked me, and I said, look, I'd done a little bit of training down in Perth when I was doing my studies for my health certificate, and they said, well, there's a camera in that room over there. You want to go and have a go at it? So I went over and had a go, and I got familiar with it, and for the last 8 years I've been doing the eye health for the service. Prior to that, we were sort of meeting with a ophthalmologist, and he was just coming up every 3 months from Perth. He'd come up and review my photos, and then he'd grade them and whatever, and then determine whether or not they needed follow-up appointments. And he would then send them down to Perth for follow-up exams and everything. And that was sort of the process for a good 5 to 6 years before they actually moved up and opened up a service up in Geraldton, the Geraldton Eye Surgery. And even then, it was still every 2 months they'd come up and review the photos of our clients, and before they'd get to see the ophthalmologist. But of late, and I say this with great honour that we came in partnerships with a couple of other groups that established an optometrist program up in GRAMS, and I speak of UWA and WACRH. The initial thing was for training, extra training for their students and everything, but also for their students to get training among working within an Aboriginal sector as well. So, you want to speak about the amalgamation?
So I think this came about because COVID hit, and the way that we were doing our eye care then needed to change as well, because we knew that it was clunky. We weren't really closing any gaps, being able to do what we could do. So already having a really great partnership with WACRH. We were approached by WACRH and then UWA to see what the possibilities were by having an optometrist on site within the AMS, which I think is the way to go, especially with all the specialist or programs. By being able to have visiting on-site specialists is absolutely crucial. So then we began the partnership. Wilfred would have had more grey hairs because of trying to chase my tail. And I think what you have to remember too, by then putting in a program within an AMS, you don't get any extra staff to be able to do that. So then the AMSs have to then absorb and rely heavily on our Aboriginal health practitioners, Aboriginal liaison officers, and our transport officers and the admin that comes around. Because if you don't have that team collaboration by running by Aboriginal people, then the programs will fail and they're not sustainable, and people will not come. So that's where it began, and I think through proper co-design and having Aboriginal people at the table is how we have made this success. And having obviously Mr. Dalgety here, who'll be turning ripe old age of maybe 21 next year. We need a succession plan. And then that leads into exactly what Jess said too, is that the lack of resources with Aboriginal health practitioners coming into this space, and that's what we really need to do as an organisation. And we've got a great board and CEO that is really going to think innovatively on how we're going to be able to do that. So that's how this started.
Yeah. And now we can sort of, focus on our clientele getting a culturally safe service. Our people are, as we know them, they're not mainstream people. It's very hard to go and send them off to other agencies and everything like that there for follow-ups and everything. So the good thing about Grams that I like is we make it a one-stop shop. So we bring them in, they come in, they see me, we do a workup, then they go and see the optometrist, and then, 2 to 3 weeks' time, they end up with a pair of glasses. So I think that culturally safe, significant piece is important in every Aboriginal service anyways. I mean, I like to refer to ourselves as, myself as barefoot doctors, because if you take us out of the equation, then it gets very hard to run a service without us, especially when you're dealing with Aboriginal people. So Aboriginal, well, Mag spoke of it. We transport our clients to the appointments. We have elderly clients that don't drive. We have people that don't drive because they can't see. So we've got a little example. I think have we got a little example of some of the things that have come across since we've opened up our new optometry service in Geraldton. So I'll get Meg just to read a few of them out. This is
So this is through having just that opportunistic, having the optometrist on site, and through going through a GP or seeing the diabetic educator or the renal nurse, then we can slot those patients in that need to be seen. So this was a couple of case studies that Sophia and Eric would have picked up in Geraldton. Middle-aged female had stopped driving and working for the last 2 years because she could no longer see. She'd previously been to a private optometrist but couldn't afford the spectacles. She'd been quoted premium lenses and frames and was too embarrassed to explain that she couldn't afford it, and wasn't given any other alternatives. So then obviously she came in to see the team, and then she walked out with a pair of glasses, and now she's back at work and driving again.
So these are some of the things that weren't getting picked up prior to the new optometrists coming in and working out of Grams. Generally, I was just doing retinal screening on our diabetic patients, our Aboriginal diabetic patients, and just looking for things like retinopathy and that there, and I sort of got familiar with looking at people's eyes and seeing which ones needed to go on and see the ophthalmologist and whatever. And I used to get Dr. Kong, who is the ophthalmologist out of the Geraldton Eye Surgery, to come up and review these photos, and he'd grade them and say, yep, we need a refer them on to the surgery and things. But the beauty of having our own optometry there now is we get our GPs, and I spoke to them and I said, look, if you come across urgent cases, by all means bring them straight to me. You know, don't send them away. Let's deal with them while we got them in the building, and you take time to do service them and you know, make sure that they're getting the right service that is required, because like I said, if we start referring them down to Specsavers, then they just don't go. They don't go for one reason or another, you know. So we do it there at Graham's. It's been a great great program so far that and it's been accepted by the community very well. The other so that, as you can see, the equipment that was forwarded through to Graham's by UWA, and was it Fred Hollows Foundation? Yep, sorry, I got the nod from Wilfred, yes. So currently I was just using a DRS. That's what I was working with for about 5-6 years, just taking retinal screening photos. But now we've got a refractor with the OTC, and the full EyeCHS is now available for all of the Graham's clients. Yeah, so the one-stop comprehensive eye test is where we're at. You know, we work with the optometrist on 3 days a week, so Tuesday, Wednesdays and Thursdays she's available, and generally it's full up. The appointment book is full up, and we're being, like I said, we've been well accepted by the community, and there's a lot of people coming through and leaving a lot happier than they were. Refraction was a big one in the early stages, where people were just you know, losing focus, and so I was just handing out the magnifying glasses, which are good for a while, but after a while, you know, they do damage to your eyes as well. But now they're getting prescription glasses, and to hear the feedback from the clientele is amazing. You know, they put on a pair of glasses and go, wow, this is awesome. You know, they can see. The other thing well received is the students when they come up and do doing their prac up at Graham's is the first time they've ever, a lot of them have ever had contact with Indigenous people, you know. So where I'm learning from them through the optometry part, they're learning from me through the cultural part. So I'm teaching them the aspects of working within an Aboriginal service, Graham service. You got anything else? No? Well, that pretty much winds us up. We're being wound up over there. So we thank you very much for having a listen to us, and I hope we'll give you a little bit of insight into the new program that we're running up at Graham's. Thank you.